chance to look at the agenda, and I will wait for a motion to approve.
I would like to add 2 items to the agenda. I would like to add the alternative pathways to the agenda and also proposed board statement.
So in terms of the alternative pathways, we haven't had a lot of time to look at it. So I'm a little hesitant to add it to the agenda because a couple days before the meeting doesn't really give a lot of time with some of our work schedule. So I would have liked to have it earlier. So I would propose we not add it to this agenda, but make it a priority for the next one.
I would like to at least have some kind of discussion on what's been brought, just to hear some feedback, and that way.
Provide that separately too, if that's helpful. Do you know what I mean?
Well, you want to be careful though. We don't
Yeah.
want to have serial communications creating.
No, I meant, yeah, directly.
Right, then-
Not like a group thing, like.
But I mean, if I talk to you and then I talk to you and then I talk to you, then it counts as and
No. Not individually.
Yes, it does.
Well, yeah.
Serial.
It does.
Okay.
Yes, it is.
So-
Serial communication.
if multiple. Yeah,
So
I
what,
I can just say
wanted to
I won't
keep
be,
it-
I won't be able to, I guess, engage in the conversation because I kind of read it last night when I got into town, so I won't have anything to share. Like,
y'all just talking about whether or not it's gonna go on the agenda right now.
Yeah,
I would like to just say what has been changed and get a little bit of feedback. And that way, if we take this to the next board meeting, I can take that feedback and incorporate it so that it is what the board is wanting. Because this is taking so long. I mean, it's almost a year now since we just started doing this.
Mhm. Well, and to be
So-
candid, I think there
Well,
were
he
other
said
ways we could have streamlined it, but this is where we are now. And I just want to make sure that if you get feedback today, that the assumption is that that's not all inclusive, since some people haven't had time to maybe look at it in depth yet. Because we
So there's a motion,
okay.
Motion
there's a
to add
motion
an
to put it on
agenda.
the agenda. We can vote on that. We can vote on that motion on each of those things separate and see if it wants to be, if we want it on the agenda today or not. So
So
there's
maybe
a motion right now to,
the motion was for both. So I'm going to ask you if you would like to amend your motion to separate them.
Okay, I'll separate. Okay.
Just in case.
so go ahead, and make your motion,
Amended
Patty.
motion.
Motion to add alternative pathways to the agenda.
Yeah.
Okay, do I hear a second? Do I hear a second?
You ready, John?
Yeah,
No
okay.
second?
Okay.
Huh?
I can see your wheels turning.
Was that a second? Did John
Second.
second that? No?
No, no second.
No
No.
second. So with no second, does that mean the motion dies?
Correct,
Yes.
Kyle?
correct. Yes.
Okay. Okay,
And
Motion.
then second motion.
motion,
What's that?
Make your
Second.
So motion to approve addition of the statement to the board agenda, proposed statement.
has everybody had a chance to read that in box?
Yeah, that one's not
Yes,
as
no?
extensive. So I'll second that motion to add that to the agenda.
Okay, all those in favor to add that to the agenda?
Yeah. I do.
Aye, sorry.
All those opposed? I oppose. Any abstentions? Motion carries. That will be added to the agenda for today. And where do we want to put that, under new business?
New business.
I don't know. I mean, I guess it's.
Yeah, on this business. Yeah. That's.
Sorry?
Yep, sure. Yes. New business?
Okay,
B? Yeah.
Okay. So do I need to approve the amended, I need to approve the amended agenda for today? So I need a second.
Second.
All in favor?
I,
Aye.
All opposed? Any abstentions? Motion carries. Approval of December 6th. Everybody had a chance to read the minutes? Any changes?
The minutes from last night.
yeah,
And do I have a motion to approve the minutes from December 6th, 2024?
Mr. John, I make a motion to approve the minutes, December 6th.
And a second?
Second.
Thank you, Patty. And all in favor?
I,
Aye.
Aye. All opposed? Abstentions? Motion carries. We're open for public comment. Looks like we have quite a bit of public out there. So anybody like to make any comments right now?
Hey, I will if I can.
You may.
Hey, everybody, it's good to see you. So understand it's not on the agenda, and I really appreciate everybody on the board's, desired interest to really take time to read through material before really discussing it, because I know that it's a pretty heavy topic, the recommendation from the alternative pathways to licensure. I would just ask the board to, when you do take the time to read through that, to really kind of read into it with the understanding, the intent that we meant it, in that we have deep and serious concern for the process in which social workers are becoming licensed in the state of Oregon and across the United States. And we have well-qualified social workers who are struggling to get licensure because of an exam that is demonstrated to produce bias results and is keeping competent social workers out of the field. And as social workers, we really are charged with ensuring social justice and equity and equality throughout our communities, not only of the people we serve, but among social workers themselves. And so I'd ask that you really consider, really what is the purpose of the exam? What is it actually measuring? And what can we do truthfully to do better and to practice what we preach? So thank you very much.
Thank you, Scott. Do we have any other public comment? If not, we're going to move forward to the recognition of board service by Mr. John Fant.
Thank you. Oh. So John, I'd like to present this to you from the Board of Licensed Social Workers for exceptional board service. I guess I would like to say that it's been a true pleasure working with you. I know I've only been here for about a year, but I have been inspired by being able to interact with you, by some of the conversations we've had, by the way you engage and how very thoughtfully you go about coming to conclusions and making recommendations. And I just want to say it's been a pleasure to work with you during the time that you've been on the board and the short time that I've been here. So
Thank you.
Thank
you very much.
We're gonna miss you. We're gonna miss you a lot.
Yeah.
I'm gonna miss not making those phone calls.
No. Thank you all very much. It's been a pleasure working with everybody on the board. When I first came here, I really didn't know what this was about, but I am glad I had the opportunity to experience, working with some wonderful people, including Kyle.
Thank you for that.
And it's been a real honor to be on this board and to look at the integrity of the board members, and what they want for their social workers to have. Hold them to a higher standard. That's impressive. And I know everybody here on this board has that desire to help them be fully competent and at the same time hold others accountable, who may fall short of that. So thank you, and I really appreciate it. And I'm gonna miss you all.
We're gonna miss.
Yeah. So thank you very much.
Pass the tissue.
So I just want to provide context for folks who have joined the meeting as a public member, but
Yes.
maybe don't know. But what you can't see on the plaque is that John has been an integral part of the board since 2017, and it is an all volunteer board, and it does require, showing up, right? Not attending, but really showing up. And you were here long before I was, and you have been such an important part of this board. So I just want people to understand the role that you've played, and that this isn't just another member kind of rotating off, but someone who's really helped, shape the state and shape the practice and really brought important perspective as a non-social work member of the board, that we really have valued that. So I just wanted to share that with folks who
Thank you.
don't know that and can't see the plaque.
Thank you. I appreciate that.
All right. Do any of y'all have any comments that you all want to?
I just think it's so important, John, like what you bring is that the community perspective, right? Like as social workers, we can come in with like our social work glasses on and the lens, and you come with this community perspective.
Yes, agree.
That just helps me like take the step back and be able to look at things and see things clearer. That I appreciate so much. And you bring so many years of experience
Yes.
working with such a wide variety of clients and agencies that that's going to be really missed.
Thank you.
And you wear the best shoes ever. So. Shoes.
Social media. That's his new game.
John's footwear.
Yes, John's footwear. Fans footwear.
And
Thank
I'd
you
like
very
to say the same thing, John. I think you wear the best shoes. You're the nappy dappy. Dress with that, set the pace for the meeting. I always want to see what you're wearing today. And when I first came on the board, you were also new. You were only a couple of months in front of me, but I always looked up to you to kind of like, how do I do this? Because I'm a public member, he's a public member. And I always appreciated your solid, silent manner where you would, when you spoke up, it carried weight because it was thoughtful and you knew what you were saying, and we all listened. And I really appreciate everything you've done for the board over the years, and especially coming back, one more meeting. Thank you for all of your time and entertainment and stories. I appreciate everything about you.
Thank you.
Moving on, right?
And before we move on, I'm going to shamelessly use this opportunity as a plug. We might have the Board of Licensed Social Workers may have 2 public openings coming up relatively soon. If anyone who is interested in applying, or if you know someone that you think would be a good board member who'll be willing to set their own agendas aside and be able to serve the public and social workers as a board member, please feel free to have them reach out to me directly, have them call in. There's instructions on the website as to how to sign up to be a public member. Public members cannot hold a license or certification through the Board of Licensed Social Workers. So for those that have licenses and certifications, that you would be ineligible to serve in a public spot, but that doesn't mean you couldn't recommend someone to serve in a public spot. So, there we go.
Well said. We're going to move into executive session, so I'm going to ask the public to log out, and we can notify you when we're done. How long do you think that might take today, Mindy? Do you have an estimate?
No more than 15 minutes, unless you guys have discussions.
Really?
Yeah.
Whoa. So the public members members of the public would sign out and sign back in about, give us 20 minutes just in case. We'd appreciate it. So we're going to move forward now to number 7, Executive Director Reports. Ray, it's all yours.
All right. Starting out with the legislative update. Let's see. So, this past, was it Thursday, Friday, last Thursday, Friday? We had to, the subcommittee, I guess the House subcommittee asked for a bunch of other boards to come in and speak on different compacts. So there were like 6 or 8 compacts. The Board of Licensed Social Workers did a presentation and what do you call it? Testimony. Thank you. Testimony on SB 2554, which is the current version of the Social Work Compact. It's no different from the opinion that I gave last, or from the testimony that I gave last time, because the bill hasn't changed at all from the last time they introduced it. Mostly there were some constitutional conflicts and some funding conflicts, and we talked about all of those before. It's hard to tell if the bill is going to go to the next step or not, but if it does, I'll inform the board and we'll move forward from there. And thank those who were willing to testify. And as I know more, I will probably be asking again for if you all will be willing to testify again. So, any questions on that? Okay. The next one is psilocybin. That one's going to be going before the legislature soon. I don't have anything for that now. He's supposed to come here. I was trying to get him to come in this week, but he couldn't. And he's going to come and talk to me and the executive director for the Mental Health Regulatory Agency downstairs sometime next week. And so we'll have a discussion on where we left off with. That was the specific language that was going to be in the bill, and whether or not that specific language limited the dual licensure to one step in the process, because I think that's what makes the difference. Is it all over, or is it just that one step? If it's just that one step, then it's much easier I guess if we have a complaint to come in, it's much easier to deal with that complaint if it's down to one step. So that's what he's going to talk about when he comes in. I'll figure out a way to get that information and to get some feedback from board members as to what you all want to do once I understand what that language looks like. Any questions on that? Yeah. The next one is this coming Monday. The Board of Licensed Social Workers has been called to do a presentation at the Ways and Means Committee, and it's basically a budget presentation. I thought I had a document ready to drop into the box this time so that you all can see what our budget looks like. But I'll make sure that at the end of this meeting, either today or Monday, I'll make sure that something's in box so you all a concise version, because what we have now is this multi-page document with like 37 things in there. And so what I'll do is I'll concise that thing down so you all can look at what our budget looks like. And then I'll also send that presentation out so that you all can see what I'll be presenting, the Ways and Means. I don't expect anything unusual to come out of it. I talked to the Chief Financial Office and also the Legislative Fiscal Office, and they don't seem to think there's anything that we as a board really need to be concerned about. The only, I think, subject of discussion that would warrant any kind of concern at all would be we have requested 625, or we requested, well, I think we requested 750. And then, and what they came back from the budget was they're going to give us $625,000 towards a new licensing system as a one-time general fund allocation. And that's gone through the Chief Fiscal Office. It's going through a Legislative Fiscal Office. They all seem to be fine with it. And so I don't anticipate that that's going to be an issue when I have that do the presentation. So anyway, so that's going to be, I'm really excited about that. So getting that money so we can get a new licensing system.
So is that on the agenda? Is that 7C, the Thentia update?
No, that one is, we're still at 7A.
Okay, oh, still 7A.
I'm gonna talk about the.
Sorry.
Yeah, still at 7A. And then the last thing is, I guess the best place for this one is the legislative update. You all probably know more about this than I do. There's, Oregon Health Authority is gonna do a rule change that has to do with, those, in our case, CSWAs, but it's basically anyone that doesn't have a professional license. They are changing their Medicaid funding structure so that only if, like CSWAs and those that don't have a professional license, and Kyle actually would know probably know more about this than me, have to work under an organization that has a COA. I'm guessing you guys know more about that than me, a COA, in order to get funded by Medicaid. So they can't work in any organization that doesn't have a COA to get funded by Medicaid, which is gonna change the way CSWAs function. So, and there's really not much we can do about, I mean, that's an OHA thing. So the board doesn't really have a whole heck of a lot to do with that, although, you're more than welcome to contact them and question. So,
Does that limit as far as employment for them?
yeah,
Right, in terms
would-
of it will
In their-
probably impact certain places where people are trying to get their clinical hours.
Especially like in rural areas, maybe?
Maybe, yeah, I don't know. I think it maybe these places that are kind of outpatient, and they almost run like a private practice, but they also are like, I don't know, they pay you like a percentage of your hours kind of thing. A little bit. Yeah, so it's not, yeah, I don't know how to describe it. Sorry, I'm having trouble. I can think of examples, but kind of like Better Health, but not that. I mean, like even a brick and mortar version of that, I think it might impact some of those, which makes me wonder, what we should be trying to message out from the board. Because what I wouldn't want to happen is CSWAs who are currently in a place like that, getting their hours and then getting news all of a sudden like, nope, you're done.
Yeah.
And I would hope that the organizations that this are going to be impacted are aware of it, but we also can't count on that, So I just would like the board to be thinking about
Absolutely.
that.
Yeah, so we'll, Kim, let's get together and figure out some kind of messaging to send out to CSWAs, so that they know how to get information on this new OHA rule.
Okay, it does look like we just had a comment that says, that will slow down the license process by limiting where they can get their hours.
Yeah, we're aware, which is why we want people to know ahead so they can make plans to shift and make informed decisions about where they're going to maybe work and get some extra hours, because it's not a board issue.
It's
It's
not a
an
board.
OHA decision.
And it's just for Medicaid too, right?
Yeah,
Yes.
right.
It won't come for other insurance.
Yes, yeah. So for some places that are only doing private insurance, yeah,
Exactly.
yeah. So it will still have an impact, but hopefully people can make the
but
pivot.
some agencies not have a certificate of approval and they just have an agreement, like say with their CCOs,
Mm,
to provide mental health services. So here I am, I'm agency X. I don't have a certificate of approval
There
from
you go.
OHA,
mhm.
but I have a contract, say with All Care or whatever, like Yamhill CCO.
Yeah.
To provide that, what that will do for that agency is, and then other CSWAs will,
But it's just
CCO
payment.
won't pay them.
It's payment.
Oh, wow.
And so then those agencies then,
Yeah.
if they're relying on Medicaid funding, will then not hire CSWAs. And then CSWAs almost get strong armed, if you will, like you're gonna have to go work for an agency with a COA.
Mhm.
And I just see like this domino effect of like, then here's an agency, I don't have a COA, but if I want to keep my CSWA, then I got to go get a certificate of approval.
Mhm.
Well, that all goes through OHA, and then OHA is just gonna like have this backup of people trying to
And-
get COA.
The benefit of that, as far as HOA is concerned, is what?
I don't know. I don't know.
Okay.
None of us were in the room for that. Did you know, Ray, for programs or agencies that don't have a COA, is OHA going to not just message to them, hey, you don't have it, but be clear about a pathway to get one so that maybe some of them could be working towards that before this actually comes into play? Did they talk about that at all?
So I've reached out to OHA to try to get more information and to be able to send some messaging to the CSWAs that are part of the Board of Licensed Social Workers without much success.
Okay.
So I have some information, and all I can do is send it out to the to the CSWAs that we have. I wish I had some direct information from OHA that was more helpful.
It hasn't
but
even been opened up yet.
No, that's what I was curious.
No.
If OHA was proactively creating like some messaging around it before it does, or like, hey, if you still have time to get your COA before this comes into effect, or to start working on it.
Yeah, there's public information floating around about it. What I can do as part of sending out communication to the CSWAs is send out information so that they can align themselves with organizations that get more information than I'm getting, that I can't do.
It also allows them to be informed enough to advocate for themselves, both
Yep, that's-
directly at OHA or maybe with the representatives if we give, that's why I want them to have it
Right.
too.
Yeah.
So they can have a voice in a place where they might be able
Exactly.
to affect it.
So that's what I can do, and that's what I will do is we'll send something out to our distribution list of CSWAs that has information that may even connect them with those that are in communication with OHA, so that if you have an interest, you can use that to advocate for yourselves. So I can do that.
Yeah, I've been asking like every other week. Is that rule been opened up yet? Where are we at?
Yeah, exactly. So, yep. So that is the legislative update that I have. Any questions on that before I move on to SB 1552? So I should have put in there, and I'll update this next meeting. SB 1552 is the predetermination measure that was passed by the legislature in the last session. It requires most licensing boards to have a path for if an individual is interested in seeing if their background, seeing how their background compares to their ability to get a license in the future. The progress on this, I'm working with about 8 other licensing boards. The goal is to make sure that whatever process we come up with, it looks the same across the licensing boards, so that if a person applies for a predetermination with, let's say, the nursing board, it will look almost identical to their predetermination for the Board of Licensed Social Workers.
Right.
And so we're meeting regularly to accomplish that goal. I don't have a timeline as for when we can have that accomplished, but I do know that we're motivated to have it done before the deadline from the legislature.
Okay.
So, and as we move with that, I'll make sure that you all have updates on that.
What is the deadline for when does the rule take effect?
I'm not positive.
July 1st.
July 1st? Okay, July 1st.
That's what we said in the last meeting, at least. I just did those minutes.
Okay, cool. That's correct.
Yeah.
Thanks, Kyle. Let me see, the Ventia update, short and sweet. It looks like the legislature is going to give us about $625,000 to invest in a new licensing system. I'm already in communication with about 4 different vendors. Right now, I'm in the process of just kind of keep what's comparable to walking around the car lot and looking and seeing what's available for us. So far, I've seen at least 2 that suffice and that fall within our price range. And so that's as far as it also looks like there's about 2 other agencies that we're going to combine our efforts to try to get a better deal.
Nice.
So hopefully we can agree on something that works for all of us, because the model is still the same across all licensing agencies, and then collaborate our money to get a better deal and go from there. So that's what kind of we're looking for. So I expect us to have something integrated and ready to roll by January of next year.
On that,
Yes.
what would be really awesome is if we had a system that we could extract data from into like a Tableau report, so that we could like see, so that we could compare like how long, I mean, right now we can't even see how long somebody's, how many times somebody's attempted a test and failed.
It just
Or-
on individual.
Yeah, it's like, it'll say when their CSWA original date was, but it won't say like how many times they've tried to take the test. And also like, there's no connection between like board complaints and different licenses So like, we don't know like what kind
Oh.
of correlations could exist between those.
Like an informatic, like,
Yeah, so that we could be like, we could extract data and like, look at demographics and look at like what are the patterns that we're seeing that we could maybe make an indication to.
Okay, so when you say Tableau report,
Yeah, so
is that talking to another
it's just like
system?
one kind of program, but it would be like, Tableau would, it like extracts data from one program and then automatically
Okay,
puts it
I got
into
you.
like
Okay,
tables.
yeah, okay, all right. And you're specifically talking about something that speaks to the ASWB's database and can
Oh.
extract data?
Oh, no, to ours. So I mean, like, for instance,
So it's set up to send out reports in this Tableau?
yeah, so that we
Okay.
could like get reports from our own data,
Okay.
where like right now, like there's no way to like read it at all unless we went through case by case.
No, we have, Cynthia generates reports, but it depends on the kind of report you're talking.
Yeah.
On the exam stuff, though.
Oh, no, not on the exam.
Yeah.
stuff. No, okay, so you're talking specifically for exam stuff?
I mean, that's one.
Okay.
And then, but I mean, like, it seems like there's other kinds, we were talking about another kind of report that would have been good earlier too. Do you remember what we were saying?
What you-
About,
Like a licensure.
Oh, yeah, about, CEUs and like,
Oh, yeah. Yeah, we don't have any reports on.
Oh, okay, is that something that we need?
I mean,
Do we need CEU reports?
whenever it's like, what kind of data do we have on this? Like people who have like, not been completing their.
Yeah, like
CEU?
CE violations. It's like
Oh,
talking
but-
about-
so different kinds of violations.
Yeah.
Yeah.
And not just complaints, but any, or any kind
Right.
of like challenges, we'll say.
Right,
about
yeah, yeah.
Maintaining and.
Expired.
Not meeting
License.
requirements,
I
yeah.
mean, I mean, there's all kinds of different
Yeah.
points of like data that would,
Yeah.
I can't think of them all now. There's probably
So you're
hundreds of.
wanting
Yeah.
board members to have access to like formal complaints and stuff like that?
Or I mean, not the specific complaints, but like the aggregate data.
Okay,
So like what, like, a program like Tableau does is it pulls individual data, aggregates it into like tables so that then you can see things like de-identified.
Patterns.
Yeah.
Yeah, so that falls under requirements, and it sounds like what you're asking for are reporting.
Right,
So,
yeah.
so that would be one of our requirements, is a specific type of report. So let me catch up with you after meeting and talk about what kind of reports we can get.
And I can try to
that
make a list too of different things that would be
Exactly.
cool.
Well, I think too, honestly, I think that the staff, if you think about the questions historically we have come to you with and like, what about this? How do we get this? Like,
Right.
you have these experiences of saying like, yeah, no, we don't have that.
Right.
Yeah. Mhm.
So I think that
Yeah.
you're good.
Oh, yeah.
And you've been around longer, right? And so you know the kinds of things that we've repeatedly asked or things that have come up that have been really hard because we've had gaps.
Yeah.
So.
Okay.
I think
And
that's
also,
too.
I'm still gonna take you up on your offer to be
Yeah, sure.
involved when we do have a new system.
Yeah,
Okay.
absolutely, yes. Yes. Wow.
Yeah, I got something to say about everything. It wasn't like advocate for me, but I was gonna remind us of like one of the, I think where we kind of strayed last time in our intention versus impact was that we didn't involve folks on on other users,
Absolutely.
right?
Yeah.
And that's always a problem when it's like, it works kind of well for staff. Actually, we discovered some things that didn't, but better than
Right.
like, and it's not just one type of user, right? But like supervisors, folks who are just have their own license and CSWAs, like making sure that we've got that experience, that lens of it. It's gonna be
Okay.
super important.
Okay,
Yeah.
absolutely. All right. Yeah, because I do involve all of the staff on
Yeah.
what's called system requirements for the next build. But you're right. I mean, we need to be integrating,
Yeah.
what CSWAs need, what LCSWs need, and then
Mhm.
also what information that the board, what you all might need
Yeah.
to make your decisions as part of the system.
Yeah.
So,
Yeah, both how we enter information in and also how do we
Absolutely.
get it? Because I know we've identified from the feedback we got when we changed this, or we're looking at changing the 6-month eval about actually the
Right.
feedback ended up being about the website or the database of like, I wish I could get this. I wish I could easily access that. So those are things that should be on that list for the vendors as well.
Yeah,
Absolutely.
awesome. Okay. Okay. So new board member update. So I expect, anything on Cynthia update before I go to new board member update? Okay, new board member update. I expect that next meeting will have a new CSWA member. And I'll send that information out, Stephanie. But well, I can't because I don't have a confirmation. So I expect that someone will be confirmed, and once they're confirmed, I make sure I send that information out. And I'm hoping one more public member confirmation. By next meeting, between now and next meeting, they'll have a confirmation. And I'm hoping to get at least one CSWA and one public member out of that. So
Do you know where the CSWA is in their process? Because I know that one of the challenges is, you know,
right.
they're sick.
Lessons learned. Yes, exactly. Yeah.
By the time they get up and running, they're like, oh, now they're licensed and they can't be in that slot.
Yeah,
So
yeah.
do they have a little bit of time left?
Yeah. I talked to this person and they're fairly early in their, I think like within 6 months in their process
Great,
of starting up. So.
thanks.
But that's a new board member update. I'm still, and I still need help building up the applicants for public members. So I'm still gonna ask you all in your own circles and, you know, in whatever you all are involved in, please do what I did today. You know, do recruitments for public board members. Because we're still gonna be, best case, we're gonna be short one next meeting and possibly, I think we got Stephanie. So when Stephanie steps, I don't have a replacement for that just yet. So I still need some help. Help me recruit, please, in your circles.
And is the governor still asking for people with lived experience? Does that still hold?
I think that's still a thing. Yeah.
So that we should tell people that they should write about that in their application.
And it's not like we have that
I'm
many
not comfortable
applicants.
with that.
I know.
Yes, that is something you want to do, by all means.
I know that when I was out talking to folks that they were like, well, that feels weird for me. And I was like, you have lived experience and I would totally talk about that because that is so valuable.
Right. Mhm.
In just like what you bring as a community member and a consumer,
Mhm.
right? Like that's important.
Yeah.
And so,
I think just saying I have lived experience, I don't need to like,
Yeah, right.
yeah.
right, exactly.
Vomit their trauma everywhere. Like that's not appropriate, but to acknowledge.
Right. Yeah,
Just
I think it is a good idea to acknowledge in the application that if a person has lived experience. I will absolutely say that. Oh, sure. Let's see, staffing update. So kind of to leverage off the presentation coming up to the Ways and Means Committee this Monday. I think I talked about this in the last two meetings. What I was hoping to do was have 2 limited durations last session and then this session have approved a full-time. They chose not to approve the full-time, but what I am hearing from the legislature is that we will not have a change in staff. And so there's some options we can use to make sure that we continue with having the 1 limited duration person that we have in Noel that you all have met. And then I'll ask in the next session if we can convert that to a full-time staff because we do have actually a need for a full-time staff. We've got that now. So, yeah, I'm anticipating a need for another compliance staff member. We need another investigator. At least temporarily, if not full time. So that's something I'll also be asking for as another investigator. And that is the staffing update. Any questions? Okay. DEI plan, I put the DEI plan in box so you all can view it. I know I didn't give you all enough time to view it and do a vote on it this time. So, you know, it's what you all want to do is fine. If you want to try to look at it and vote on it this time, that's fine. Or you can just look at it and then next time we can vote on it. But I'll let you all make that determination. You're the board, but I put it in there. So, but you know, there's also the feedback mechanism. So look at it, feedback, and then, you know, give me whatever feedback you have and then go that route. But it is in box now. The Rules Advisory Committee, we've reached out. Did we reach out last week?
Yeah, we need to follow up though.
Okay, all right. So we reached out to remind those members who had interest in the Rules Advisory Committee that we're putting some dates, getting some dates together to meet. And so hopefully by next meeting, we'll at least have at least one meeting of the Rules Advisory Committee. So that's that. And then I'm going to ask that we do the licensee stats and the applicant stats in the next meeting. You know,
In the next.
have those available.
I can also email those out.
Okay. Or, well, you just put in box, all right?
Yeah, that's fine.
People like-
Yeah.
So she's just, have them uploaded in box. Yeah, it was a rough time. These past, we had, DAS occasionally asks us for these reports that we have to put together in no time at all. So we got stuck with two of those. And then we had the presentation that we had to go to for the compact, and then another presentation for this Monday's board, Ways and Means, and it was just too much. So we weren't able to get that.
I mean, honestly, I think the licensing and applicant statistics are less of an urgent agenda item now than they were when the board was struggling to like stay on, like process them. So I think it's fine if occasionally, like, you know, we know we're on track. We've been on track for a while. The delays that were happening have been resolved. So just want to acknowledge that there's a lot of work around that. Doesn't feel as urgent.
And you haven't seen any like significant like dips or anything, so.
Yeah.
Yeah, we're actually,
Yeah.
we're consistently doing better than the 30 days.
Mhm.
So, and we're actually doing process improvements to move towards actually formalizing less than 30 days. So, yeah, we're doing good. And that is all I have. Any questions, concerns?
We had fee increase on here. Did you address that?
If you flip the
I think
blue.
that was like a.
Right, that was
Underneath the rules.
yeah, under the rules at advisory committee action item. But yeah, I mean, that's not so. What I'll do is I'll come in with the budget again in the next meeting. But I think I talked to you all before. We need to ask for a 20% fee increase. And that's, I've got the numbers to back that up. We have the authority to do that. We don't have to go through legislation to do it. Now, I do have to ask for expenditure, so I have to ask for the ability to spend it. But we can do the fee. We can actually do the fee increase internally. And yeah, I'll bring the budget next time and go through the numbers. But I think when we talked about it before you all approved that, I can start activities towards 20% fee increase. But yeah, we need
What does
it.
that come out in dollars? For license,
Didn't
what does that come out to?
It was in my.
Yeah, we did
What's the current fee?
Yeah, hold on.
What's the 180? 280?
For like renewal or application.
I guess it's
After
what
renewal
you're
is
asking.
286.
286.
And
So
the like,
that's about $57
yeah,
increase for that one.
and then applications for LCSW, that's 460. CSWA applications are 260. LMSWs, that's 200 for applications, and RBSWs are 150 right now.
So it ranges between about $40 to $60 increase-ish, kind of depending on where people are at in the process.
Yep.
Just to answer your question, Stephanie.
And when was the last time we had a fee increase?
2017, was it?
I think that's what we said,
Yeah, 2017.
Wow.
So it's
Because I
been a
think
while.
in between
pretty
that, we had a
impressive.
fee decrease.
Say again?
Hmm?
Stephanie?
I think between that time, we also had a fee decrease.
No.
I don't believe.
No, there was some funding from the state that paid, that some people could access to pay for that fee, but it wasn't a decrease.
Yeah, it's from Rachel.
Which ironically enough, so yeah, OHA paid for some application fees.
Yeah.
But the net of that, I think we actually wound up paying for that because we had some staffing challenges at the same time that OHA was paying for those. So we had a dramatic application increase.
Yeah.
But we had a staffing decrease, which wound up being a backlog, which is what I wanted. But anyway, we figured it out. So, but yeah, we can't do that again. I think we actually lost money on that deal. So.
It's great. It was great for the applicants.
Exactly. All right, so I don't have anything else to add.
Thank you, Ray.
You're welcome.
Committee reports.
Okay.
CPC, you are up.
For Consumer Protection Committee report, we have
10 cases that we're bringing forward with motions. So I will read through those. In the matter of case number 2011-55, I move that we close this case.
This is Amy, I second.
Thank you, Amy. Those in favor?
I,
Aye. Any opposed?
Are you opposing?
No, there's a delay in
Okay.
audio, I think. Do you want me to redo that for the record?
Okay.
Stephanie, we're interpreting that as an aye in favor, correct?
Yeah.
Okay. Okay, there's just a little delay from you to me, so I'll slow down. Okay, any opposed? Any abstentions? Motion passes. In the matter of case 2012-17, I move to close this case. Those in favor?
I second.
Oh, sorry. I was still be quiet and get, sorry, Patty a seconded. Now, anyone, those in favor? There we go. Okay. Any opposed or abstentions? Motion passes. In the matter of case 2020-11, I move to dismiss this case.
John, I second it.
Thank you, John. Those in favor?
I,
Aye. Okay. Any opposed? Any abstentions? Motion passes. In the matter of case 2020-44, I move to dismiss this case.
This is Amy, I'll second.
Thank you, Amy. Those in favor?
I,
Aye.
Okay. Any opposed or abstentions? Motion passes. In the matter of case 2020-46, I move to dismiss this case.
John, I second it.
Thank you, John. Those in favor?
I,
Aye.
Okay. Any opposed? Any abstentions? Motion passes. In the matter of case 2020-47, I move to close the case.
Patty, I second.
Thank you, Patty. Those in favor?
I,
Okay.
Aye.
All right. Any opposed? Any abstentions? Motion passes. In the matter of case 2021-08, I move to close the case.
This is Amy, I'll second.
Thank you, Amy. Those in favor?
I,
Aye.
Aye. Any opposed? Any abstentions? Motion passes. In the matter of 2022-02, I move to dismiss this case.
this is Patty, I second.
Thank you, Patty. Those in favor?
Aye.
Aye.
Any opposed? Abstentions? Motion passes. In the matter of case 2023-06, I move to close this case.
John, I second it.
Thank you, John. Those in favor?
I,
Aye.
Okay. Any opposed? Abstentions? Motion passes. In the matter of case 2024-43, I move to dismiss the case.
Patty, I second.
In favor?
I,
Aye.
Okay. Any opposed? Any abstentions? Motion passes, and that concludes the CPC agenda. Or motions, excuse me.
all right. Licensing and exam. Will you do licensing and exam? I'll do CEUs. Thank you.
Okay. The licensing and exam committee approved previous hours requests for LCSW applicants Shelby DeBoard, Stephen Blout, Nicholas Bolton, Jamie McDermott, and Caitlin Truitt. They approved some CSWA plan changes for Ala Hamid, Amy McFeeters, Annie DeMata, Chelsea Vargas, and Paul Peters. They approved temporary supervision reduction requests for Christina Di Benedetti and Annie DeMata again. And they also reviewed supervision hours requests for Jennifer Slippy. And we're gonna get more information. We're gonna contact the administrative supervisor for confirmation. Basically, the CSWA couldn't get a report from their supervisor. Supervisor no longer works at the agency, so we're gonna try and get the hours confirmed another way. And so we'll bring that back for the committee next time, or if the administrative supervisor confirms the hours then they're good to go. If not, then we'll bring it back to the committee. We had a supervision hours request for Lisa Geis. I'm not sure how to say that last name. That was not approved. They were requesting group supervision hours retroactively. They didn't have a plan in place with that supervisor at all. So the committee did not approve that request. We had a supervision hours request for Mary Nesmith. We're gonna bring that one back. It was a reduction in supervision hours, but there were some months where they weren't able to get any supervision at all. And the rule is specific to you need to at least have 1 hour a month. So Cassie's gonna go back and contact them to kind of revise what they submitted, and then we'll bring it back to the committee. And then we just had some staff discussion and guidance on, we had some supervisor concerns. We had an expired LCSW, a new LCSW. We talked about the agency definition.
Meaning definition of agency, the word agency?
Yes.
Okay.
By statute.
Yeah, I just wanted to be clear.
Yeah. And we have some draft letters that the committee would like the board to look at. So I'm going to drop those in box, and they're draft letters for like unauthorized practice. And also there's some CE ones for like CE violations. Wendy's drafted those up, and it's just for future conversation, like
To use as templates,
Yes.
kind of, to be consistent.
yes.
Okay, thank you.
Yeah, and so the committee wanted the board to take a look at those and then add a discussion topic for the next meeting to talk about it. And then another thing that the committee talked about that we wanted to also bring to the full board was right now, the way the system is set up, a CSWA, when they're submitting their plan, they have to select a supervisor and then specifically select if they're individual or group or both. A lot of the times someone will either forget to click both, or, you know, maybe they originally agreed to meet individually and then not long after they're like, oh, hey, actually I have group supervision sessions, you can join too. But historically, if someone only had, like if Amy was my supervisor only for individual and then I met with her with group, I couldn't count any of my group hours with her just because there wasn't a button ticked. And so, and the rules don't actually explicitly say that. It's just the way the system is set up. So staff were wondering if, you know, if someone is an approved plan supervisor, do we really care if they're meeting individually or in group?
If it's the same
If
supervisor,
it's the same
isn't that
supervisor,
important? Yeah.
like moving forward, especially with a new system, like, do we want to set it up? Like,
Yeah.
if you're an approved supervisor, you're on their plan, you're in the system as their supervisor, can you just choose to meet individually or in group?
I think as long as both parties know the requirement of like what the limitations of group supervision are.
Yeah.
Right? Like
Yeah.
if they were to, if they truly knew like it can't all be group supervision.
Right, it had only up to 50 hours could count.
Right.
Yeah, and the group can't be more than 5. Yeah. Like we could put the parameters right there so it's
Right.
clear.
Yeah, I think that's the issue too, is that you can only count a certain number of group supervision hours, period. And so we just want to make sure that people understand that. So as they're approaching it, if they need to make adjustments, right? I mean, they can continue to do group supervision, but it won't count towards their
Exactly.
supervision hours.
Yes,
And I
right.
just, that has to be really explicit.
think
I mean, I would hope people would know that hasn't changed,
For the
but
most part, I think most people know they need to get at least half their supervision needs to be an individual, and we could make that very
Right.
clear.
We can,
Mhm.
we can
But
make that.
we're just kind of wondering, like, is it that important? Like, as long as a supervisor meets our requirements, do we really need to
Yeah.
separate
Well,
on
it
the
is-
plan so
It
much?
it is a holdup, and I'll just say this as a supervisor, it's a holdup, right?
Mhm.
Because I'm just, you know, thinking about my own place of employment of like, okay, well, we do group supervision twice a month.
Yeah.
Then I have to have my CSWAs go in and do a brand new plan to include group supervision because they didn't put it in their.
Right.
Yeah.
So, which is
Yeah.
fine because I mean, they'll
Mhm.
continue to come to group supervision, but we together have to make sure they're getting their individual done until
Mhm.
that new plan gets approved.
Yeah.
So there's
Yeah.
just a little holdup.
It is, yeah, and it's.
Yeah,
Well-
it makes sense, I think, for the same supervisor, obviously,
Yeah.
like if someone's meeting with Patty for individual and now they're gonna meet with Amy for group, then that would warrant an addendum to the plan, because it's a new
Absolutely.
person.
New supervisor, yes.
Yeah,
It's a new plan.
yeah,
Right,
a new
yeah,
plan.
exactly.
Yeah, yeah, I appreciate that the staff are trying to think about like,
Wendy's
what's the
trying to-
intention here and how can we streamline it, so.
Stephanie's trying.
Mhm.
Stephanie, say it again?
Oh, Wendy, you said.
Wendy,
Um,
and
Yeah.
I
Yeah.
just made a comment that the hours are still gonna be separated on the supervision report. So as far
Yeah.
as the 50 individuals, we'll still know that. They're still
Yeah.
gonna have to say how many group they did, how many individual.
Yeah,
Yeah.
I'm not worried about the board tracking it, more about
Right.
making sure CSWAs are still attending
Yeah.
to that.
Yeah,
So,
Yeah,
but yeah.
we'll know if they're going over, so we can let them know.
Mhm.
okay.
Yeah, but
Yeah, so-
appreciate the intention behind that.
Well, so to be clear, if their supervisor hasn't changed,
Mhm.
then is there a requirement that the staff differentiate between group hours and supervisor hours, provided they're only doing, that the limited group hours that they, we can take care of the hours numbers. But, if they don't click the box, but they did group supervision, it's okay to go ahead and give them hours, hours. Okay, great, awesome.
I
Okay.
think so. Are we in
There's no rule
agreement
constraint.
with that?
Oh, I'm sorry.
Just making sure.
Mhm.
Okay.
Yeah, it's really just a matter of what is the intent of the board, because a
Yeah.
rule is kind of vague. on
Yeah.
that. The rule does not limit the ability to do that. It's the board.
Yeah, I
Okay,
think
cool.
it's one of those things, particularly when we get a new system, right?
Yeah, oh,
Yeah.
Whatever that is,
Yeah.
of like, even if that's super clear on there of like, here's what it is, because I mean, while I know that it's in. Well, it doesn't mean that
all right, the
we
people
all
know it.
remember all
course.
of that
Absolutely,
stuff, right?
yes.
And I just
We
think
know
even
that.
just a little caption of like, here's like the max, so that supervisors are well
Right.
aware, like, here's what I'm gonna need to do for my CSW.
Absolutely.
Yeah.
Okay.
Great, thank you. Whoever
Document
brought this up staff-wise, please thank them as well.
Leave that started with Cassie. I don't know if
All
she's
right,
listening
Cassie.
right now, but I'll make sure she knows.
Yeah, yeah. And
The rule on agency is like a super tricky rule. That
I mean, the definition of agency, yeah.
In statute, yes.
It's complicated.
Is it in statute or is it a rule?
Oh, it's in rule. Okay, I'm sorry. It's in rule.
Yeah, and I don't know if when the rules committee gets together, if they want to look at this again, because what Kim was saying is that this has changed many times since she's been here.
Well, it's changed once before, like they eliminated a couple of the requirements to, I think, make it like easier.
Broader.
Yeah, more broad, but now it's almost like too broad or.
Right.
I don't know,
Yeah.
so.
Yeah.
Well, there's one little phrase in there that like my brain does a little hiccup around it, that I'm like, is it
can't
the
remember.
whole agency and its employees? Cause I think it says and its employees, but I'm like, wait a second, like.
What's an employee?
What's
It's
an
been a big
employee?
question,
Yeah.
yeah.
'Cause
Yeah.
The way it's written right now, a person could have a private practice
Yes.
if they hired an administrative supervisor and clinical supervisor.
Yes,
And the billing's done through the agency. and
Right.
all that.
right.
Yeah.
But the hours,
Yeah,
they don't, as long as they are doing hours under an approved agency, then they can do their private practice and the hours won't count towards their license, but they can, they will comply to rule if they have an administrative supervisor and a plan supervisor.
If they
But they don't have the agency.
If they open their own business
Yes.
and do private practice under the name of their business.
Yes.
With an administrative supervisor and a clinical supervisor, then they're an agency.
I don't know that that's true.
I thought that's
don't know that
what you were
true.
explaining to me.
No, I don't know that that's.
The challenge has been around how practice has changed, right? I mean, that was written before telehealth was a thing and before
Exactly.
these entities existed, like
Right.
Better Health or other places where you contract and they handle.
Uber therapy.
Yeah, all these kind of layered pieces of, are you an employee or are you just on a contract, So
But I do appreciate Patty looking like with the rack in rule update. Is
Yeah.
that something you want to look at?
Oh, absolutely.
Yep.
Okay,
Okay,
the continuing education.
continuing education.
Okay. So, did the, continuing education committee, supported a credentialing body request by Western Oregon Mental Health Alliance. We, Alicia O'Connell asked for continuing education for deliberate practice supervision residency program. And we supported it upon completion with her certificate. She hadn't completed it. So as long as she brings in a certificate, we'll count those hours towards. Elizabeth Miller asked for units from inner transformation or for social impact leaders. And we supported it for 7.5 of the contact hours. There was out of class hours as well, but because the continuing education is only contact hours, we only counted 7.5. Evian Dougherty asked for units from cultural and ethical considerations and clinical supervision. Supported that for 5 hours of supervision continuing education units. Kathy Lawrence asked for CEUs from emotionally focused therapy training. We supported that for 10 hours. Megan Tooker asked for CEUs from foundations for working with military connected survivors of domestic violence, dating violence, sexual assault, and stalking. We supported that for 4 hours, CEUs. Sophia Kahn asked for CEUs for practical clinical supervision, and we supported that for 10 hours, supervision hours. She had asked to complete her supervision training under that, but we can only do 10 hours. Dana Sexton asked for us to open a new study group, and we supported that new study group. Deborah Rubin asked for continuing education partial waiver. And we supported the waiver for half CEUs based on some health concern. Karen Willow asked the same, a partial waiver request, and we supported that for half CEUs for a health concern. We had a discussion on continuing education compliance, and there's been a number of cases where people just don't do continuing education and then pay the fees.
Yeah.
And then I guess even sometimes are required to reapply for their LCSW, and then they do that.
Yeah.
And then they don't have to take any continuing education for 4 years.
Yes.
And they do it again. You'll get CE.
So
Yeah.
that's a trick.
Hence the need for consult.
That's the need for rule update, yes.
When we had another discussion topic on continuing education compliance letters and how we send those out.
Yeah.
We did a couple of drafts. That's all.
Thank you. Moving on, there's no special reviews on the agenda, but we're open to public comment now. If anybody in the public has anything they would like to share, it's your time now.
Hi, Delmar with NASW. Hello, everyone.
Delmar. Hey, Delmar.
The only thing I have to, I'm sick, so I don't have my camera on. I'm actually laying in the recliner and messy hair and have not shaved, so you do not want to see me.
Got a visual though.
But I just wanted to mention we have our Advocacy Day Tuesday, and it's looking like a pretty good turnout. So we do this every year. We have dozens and dozens of social work students and a few professional social workers, regulated social workers, who lobby or advocate. And so we're looking forward to that. That'll be, like I said, Tuesday. And then we may do a follow-up depending what's happening with Interstate Compact and other issues in Oregon that might need advocacy. Yes.
Delmar, what was that date again? What is the advocacy day? Tuesday? Okay, thank you.
Tuesday.
Okay.
Tuesday, I believe it starts at 9 a.m.
Where is that at?
It's going to be.
Where is that at?
I think it's going to be all on Zoom. And unless we
Okay.
have a group, there is a group of Portland State social work students who want to be in Salem in person, and we'll accommodate that if they want to do that. So otherwise, it would be in Zoom. And that's it. That's all I wanted to report.
Feel better and thank you.
Thank you. Appreciate that.
Any other public comments? If not, we're gonna move
Delmar?
forward to.
Oh, wait.
Can I ask Delmar, for folks that wanted to partake in that advocacy on Zoom, will that be on the website so they know where to go?
Yes,
Okay.
it will. And I was hoping Henry could be in this meeting and talk more about it, but they are actually in a planning meeting because they were not tracking that you all were meeting at the same time. So I'm going to pop over there.
Okay.
And I'll have more info. And I guess should I send the info to Ray, Wendy? Where do you want that to go? Kimberly?
For
Tuesday.
For Tuesday?
You can send it to me. That's
Yeah,
fine.
send it to Kim, please.
Okay, sounds good. All right. Thank you all. Have a good rest of your afternoon.
You too.
Thanks,
Thank you.
Delmar.
Moving on to old business.
Can we hold just
we have interstate-
Stephanie, can we just pause and just double check that any of the folks who are here as public members, this is your opportunity for comment. So just want to make sure that we're being clear about that and pausing long enough for someone to find their unmute button. Okay. Thank you. Thanks, Stephanie.
Okay, we have interstate compact update, but didn't you deliver that at your director
I
report?
did already. Is that part of the agenda? Yes, I did.
Business.
Oh, old business. Okay, yeah, I did already.
And the
did
same
that.
with the psilocybin.
Yeah, I did
came in
that
your,
too.
report
yeah.
there too.
Thanks. Yeah.
Is there a date that they're going to vote in the committee?
No, so we have to track that. So they only posted so far that I'm aware of that one where they had all the compacts to come in at that same date. And so I haven't seen any activity since then, but we're monitoring, see what comes next.
Okay, thanks.
What was the
They
bill?
they had a meeting, but they haven't
HB
posted their minutes.
2554.
They had a meeting in February. The compact commission had a meeting in February, but they haven't posted their minutes yet.
Oh, okay.
Oh, now the fun
Oh,
one,
yeah,
new
it's on
business,
the agenda
April
too. Amy.
travel.
Yeah.
Oh, but did you get another?
April.
Where are
Whose
we at
item
with
is
that?
Oh,
Kim?
the travel meeting. Yeah.
Is that where you guys are going to go somewhere?
I don't know.
Coast.
I don't know.
Oh, you going to the coast?
Well, we were gonna go to the coast, we just couldn't find the date,
Date.
right?
Right.
So, yeah, so what's the agenda item
Great.
exactly?
Newport
Yeah,
was
yeah.
the
Broad.
place.
I think it's
Scheduling?
figure out a date. Yes.
Okay.
Yes.
Yes.
Also, do we know what we're doing there? Because we didn't talk about that last time either.
It's a board meeting.
I mean, we're gonna have a
Oh,
board meeting, but
additionally.
it's gonna be 3 days, right?
Is it?
Well, that's
Or is it just one?
what you guys need to decide, but it's
Okay.
maybe one night, maybe 2 nights. I don't know. Like, I think we decided the board meeting would be on a Saturday though, so public could come, right?
Right, and we were talking about having some. At one time, we were talking about having some kind of continuing education attached to it.
Yes.
To like attract people.
Yeah. So
Like on Friday?
Isn't that what we did in
Uh-huh.
June of 2019? We were in Bend Stephanie, didn't we have it at the community college there? Or one of the college campuses?
Yes,
And was it,
That one,
yes.
that was two. Because we had like a full day there. Like, I
yeah,
don't,
we had like, compliance was a big, that was
Yeah.
a big compliance meeting too.
do you have to allocate
I
travel
don't remember if it was 2 days or not.
I think it was 2 days.
It was.
Came in the night before, then we all like had dinner and stuff like that.
Yes.
Then the next day we went into,
Yeah, that would make sense.
yes.
Yeah. I think you're right.
That is what happened.
If we did have a continuing education piece attached to it, it seems like the board could do an ethics training or would be appropriate to do an ethics training, which is really hard for people to get.
Yeah, last time we did a supervisored one, but ethics would be good too.
You mean for the board, right?
Oh, no.
No, for the public.
For the public?
Yeah, from the board.
Okay.
Yes.
Oh, you mean the ethics,
Yeah,
the
'cause
board,
like
the board of
continue-
social workers ethics.
Like
Yeah, 'cause-
the requirements.
So we're required 6 hours of ethics training.
Oh, I understand.
Every 2 years, and it's also the most boring possible training you can imagine. Usually, it's almost always basically the same training repackaged over and over.
Yeah.
But having one from the board, I think, might be like an interesting thing for people when we're actually talking about.
So it seems like the first decision is if we're adding on a training and then looking at dates, and then there's time to figure out content of the training. But if is there general interest of us providing some CEUs to try to pull community members into that area?
That's a good idea. I know last time we did a supervisor one, so I think ethics would be great this time around.
I mean, it definitely gets people there if you do it on like the
Especially if
day
you say it's
before.
free CEs.
Right,
It was
because then
free.
you're like, we're doing a
Yeah,
board
yeah.
meeting tomorrow. We would
Yeah.
love for you to show up.
Yeah.
And then.
Okay, so we're in agreement that we're gonna do some kind of training, possibly ethics, but we have time to kind of figure that out. So we are looking for 2 days then in a row that we're all available, correct? Okay.
Saturday. and
Wasn't the
Sunday.
board originally scheduled for April
Friday.
18th?
Oh,
Yes, but that's like Easter weekend.
Oh, it is?
Yeah, so if we do it over the weekend, it wouldn't work.
Yeah.
so wait, when you did it last time, was the training you provided the day before the board meeting or after?
I'm trying to remember.
Cause it's is it Thursday, Friday, Saturday?
I'll have to
I think
look.
the training was,
Friday,
Be-
Saturday, right?
yeah, we did
Yeah.
Friday, Saturday. I think the training
would
was
make
before
sense.
the board meeting.
Like the morning?
That makes
Like
sense.
it was a half day kind of thing?
Yeah.
Okay. Oh,
Was
okay.
it?
No, I think the board meeting was first and the training was in the afternoon.
That's kind of.
But it was one day.
Yes.
Yeah.
I remember driving down and
Okay.
back, so.
So it is
I had to be there in the morning.
possibly just one day that we need then.
Like a full
For
day
us, I'm
for,
talking about.
like, board business.
Yes.
Saturday would be a very full day.
Yeah.
Like a 12-hour day.
Well, no, it sounds like what you did in the past was make sure that that board meeting's agenda was short enough that it was achievable in an
Right.
afternoon.
Yeah,
That's what
So I think,
I'll go
That's
back
the
and
whole-
look, but because
right?
quite some time, but it was a
I can
full
certainly do.
day. I remember being like,
Yeah,
yeah, so long.
If you had training like at
Okay.
1:00, 1 or 2:00, that way you can get your lunch out the way, all that stuff.
Okay. So we are, just to clarify, we're looking for one day that we're all can be available for that, and then the people decide whether or not they're coming the night before or staying the night after kind of thing.
Yeah.
Okay. I just need to know for my calendar, like, what am I looking for availability? Okay. And it needs to be sometime in April, but the 18th is not an
It looks
option.
like we're the 18th, and I can't do the 26th. So we're knocking days off here quickly.
Yeah.
I think we're down to the first weekend in April right now,
Getting married the
the
5th.
5th.
I can't be there on the 11th, but I don't think I should be a barrier to scheduling this. I think y'all are very capable of functioning without me. So I just want to name that when the email went out, I said I can't do that whole week. There's a small chance I could, but I'm literally not going to know until like the day before. So, but again, I don't want to be a barrier to scheduling
On the 11th.
on the 11th. Yeah, that week is the 7th.
I'm gonna be on vacation, but I could appear remotely if I have to.
Vacation.
Yeah, no, I'm gonna be on vacation.
The 11th is
losing my daughter on
Friday.
the East Coast. So.
What?
but I would be willing to appear remotely if that's
Okay.
necessary.
On the 11th?
Yeah.
Okay.
If you're not here on the 11th, then we don't have a quorum for CPC because we don't have John.
Right.
Another board member can step in, but
Well, they have to have the background check done.
I thought we were gonna do the board meeting on Saturday.
Maybe we should do that.
Everybody-
Because
Day for everything is what we're talking about.
no, I know, I'm saying that if we are as is right now, then we wouldn't have a quorum. for CPC unless-
I might be, I could be like remote for
Okay,
that. I
okay.
think that could make that work.
On Saturday, on that Saturday?
Oh,
why are we talking about Saturday? We're doing Friday.
Saturday, not Friday.
no, it's
No,
Friday,
Saturday. It's Friday, Saturday.
Because they're gonna do the,
It's actually Saturday.
yeah, it's actually
It's
Saturday.
Okay. Okay, I thought, I could have sworn we said we were doing it all in one day. Maybe you and I had a conversation no
And
one else
that's
had, I
Saturday.
think.
They're talking about the training. The training
Yeah.
and the board all in one day. That's Saturday, but you would come over on
Oh.
Friday.
Yeah, I thought it was Friday.
Yeah.
Sorry. I think I can make the 12th work because we kept saying the 11th. So if we're talking about the 12th, that is different for me.
Yeah, so
Okay,
if you,
yes, I can do the 12th. Let me just say that. Stop, and then I'll stop.
So everybody, because everybody's come from different,
Mm-hmm.
because it would be Newport too.
Yeah.
That's it.
Yes.
Would you be able, would that work? Or you're gonna do remote?
Do the 12th.
Okay.
Okay.
Could make it work. Done. Are we done with that agenda item?
Did we
we
decide?
really
on-
done? Really?
It's up to y'all. Did we decide on the
Kyle?
I'll be on vacation, but I can make myself available.
Okay,
on the 12th,
so Kyle would be remote.
I'd have to
He'll
be
on
remote.
vacation.
Do you want to
And I'll have to get up
vacation?
really early. 3 hours difference.
We clearly don't care about you because that is part of the conversation.
Kyle, he
I
gets
know.
abused.
I'll manage. I don't want to be the one that holds up.
I have a different board meeting, but I can cancel that one.
It's remote.
Are you gonna be on the beach on your computer?
Yeah, that's,
Me? No, I will be on the
Yeah.
East Coast in Boston.
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 Visiting my
I like Boston.
daughter and son.
Right.
That'll be East Coast hours, so that'll put you 3
3
hours
hours.
ahead of us. So we'll do our meeting in the morning, you'll do it the afternoon and blah, blah, blah. Okay.
So if it's 8 here, it'd be
11.
11
there.
there. Yep.
Okay.
We got that all set then? We're good?
We actually-
Well, did y'all decide on whether you want to do a CE or not? So we got the date, which is 12.
Yeah, we have the date set.
it's kind of a bummer though, isn't it, to like have Kyle working during his vacation?
Right. I'm willing to do it. It's not a problem.
CPC stuff ahead of time and just let you know if he has concerns before his trip.
It's up to you, but I'm willing to.
He said he's willing.
I'm willing to do it. Make
When
it-
do you start your vacation? What,
Oh, I started on Thursday.
the 11th or 10th? Okay.
10th, yeah. So I'm gonna be flying out. I haven't made my flight yet, actually.
And how long are you gone?
Poor Kyle has no privacy today.
I'm gonna be gone through, well, I was planning on coming back Thursday because we had a board meeting on
The
Friday.
18th. yeah.
So, but I haven't made my reservations yet, so. I will probably come back actually on that Saturday then,
Okay.
so.
You know, if you were union and I was your steward, I'd be like,
No.
Kyle.
It's been, so.
Cause see, I mean, I feel like we've worked with you, like, I fully expect you're a grown up, and if you really didn't want to do this, you'd be like, yeah, I can't be
Exactly.
available, cause you've said that to us
Absolutely.
before, I can't be available, so,
Kyle will tell you no.
yeah.
No, I'm gonna probably might need to work.
No problem.
He loves that.
Okay, so the 12th. In terms of though, because that is the next board meeting, if we're gonna be offering some CEUs, do we need to
Okay,
create
but
some kind of subcommittee to have that conversation, or to, I don't know if subcommittee's right, I don't wanna make it too official, but who's gonna prep, who's gonna decide what we're offering and then prep it and then facilitating and all that?
Wendy says we can do that. Wendy says we have the authority as a board to create CEs.
Right, but my question is like, because I don't think it's necessarily a good use of like this meeting's time, but we need to prep something before the
Right, a
12th.
curriculum.
Yeah, what's the content? Who's delivering it? Like, when does that happen? How does that happen?
How
However,
long do you want it to be? You want an hour? You want 2 hours? You want 8 hours? How long does,
I mean, it would be cool
2
if
hours?
somebody could get their entire 6 hours knocked out, but
Oh, my
No.
God.
well, Ray, when I,
that's not gonna happen.
Ray, when I said we could do that, we were talking about the supervision training,
Oh,
not
okay, I'm
just for a
sorry.
general meeting. We still
Okay.
have to be able to meet the requirements of what a continuing education is before we can give them
Yes.
credits.
Okay, all right.
So I mean, if
Thanks,
you're gonna
Wendy.
do a training in something, like if you're gonna do an ethics training as part of the meeting, then yes, that part of the meeting, we could do that. Because it would be a workshop.
Are we only offering that in person or are we offering it remotely
We don't
as
have,
well?
we don't have any rules that says it has to be in person. So
Yeah,
if
if
somebody
you're
was, if
remote.
somebody was
No.
online.
How
we
you,
could
how you
give
gonna
them
be
the
set
same.
up?
No, my issue is it's a very different training. And so we have to decide that ahead because what you develop for as a trainer is going to look different for in-person versus if you're trying to do both or just all online. So I think we do have to decide what we're offering. But if the intention is to have people physically come and be a part of the meeting, then maybe we only offer it in person. I know that does limit, but
It
again,
might get more people to come to the meeting.
Yeah.
hey, Wendy, what is required for something to be count as a CEU training? You said that.
It would need to fit the rules. It had to fit our rule requirements, which is the types of continuing education it is. So it would have to be a book, a journal article, a workshop, or a seminar. Is basically what the rule says. And then if it fits that type of continuing education, we're the accrediting body. So, I mean,
Credit.
yeah. So we're gonna approve our own CEs.
So last time Randy just did that slideshow on supervision requirements and he just basically went through the whole slideshow. And
And that was C?
yes,
Right.
Slide.
I think he gave 2 CEs for that. 'Cause
Don't
it was
have
about a
that yet.
2-hour, it was about a 2-hour training. So we gave 2 CEs.
yes, yeah.
So it sounds like there's
So
an
Ray has to
option.
do this? Is that what I hear?
Oh, I don't mind doing it.
Since Randy did it, do I hear that Ray has to do this training then? Is that what
Well,
I'm hearing?
I don't have to, but I don't mind doing it.
I'm gonna throw this out again. Is this the level of conversation we need to have right now? Or can we take some of this outside the larger meeting? We've decided when, how long, and maybe even top it, but can we work the details out outside of this?
Yes.
Because
Well, I
don't know.
Have to think.
I would think so.
As long as Kyle's.
Well, that's a board, I mean, that's a board decision as far as the details.
Is it?
Well,
Does
you-
it have
the
to be a
board-
committee?
The board could delegate it to one board member to
Right.
work with Ray on the details. You couldn't
Okay.
do it as a group.
So it sounds like the options right now are there is an existing presentation that I could do as part of the meeting that already has been approved, that the board has already approved for 2 CEs.
Well,
And
that's
that would be
supervisor
That's a
training.
supervisor training.
supervisor training.
I was just giving you an example of how it was done last
Oh,
time.
okay.
What
And then the
training?
other,
I must have missed it. What training are you wanting to do for the meeting?
Ethics.
Ethics, okay. Okay.
and the other option would be, like Kyle said, someone working with someone on the board to create a curriculum and then present that curriculum.
Sorry, I'm having a side conversation with Amy about who would be a point.
Yeah, that we need point. There you go.
No, yeah.
Straw.
Oh, yes. No.
Oh, I would do it. Yeah.
Be the point in terms of helping. How about this, in terms of developing kind of it with where we can share opinions around what could be, and we can even decide who's facilitating it later as well. That doesn't have to be decided right now.
Well, so I'm going to take a second because Kyle's sitting here. I believe, so I'm not thinking that a CE would affect a policy decision.
Yeah.
And so since it doesn't affect the policy decision, we can have whatever conversation we want to about it.
Yeah. Right? About the content of a training.
Public meetings law.
Does it require board approval or is it part of
No.
the business?
Nope.
The approval is just that we're doing it.
Is it between less than a quorum?
No, because quorum is two, right, or 3.
Quorum is 4.
Right, but why don't we, so I guess, so the question is, to create a CE, do we need does does creation of a CE, how does that apply to public
Who
meetings?
approves it? Who approves it?
Approved.
Oh, okay, I see what you said.
Who approves the CE?
So
Can we delegate the authority to a board member?
I haven't looked at the rules for that purpose. Assuming we could do that, then that would be a way to get around. Or I shouldn't say get around, that would be a way for the public meetings law not to apply.
Right, exactly, and that's.
Individual made the decision. So-
Because that's the question as to whether it applies or not.
Right,
That is
right.
the actual
But in
question.
regards to approval, I'd have to look at the rules to see what they say. I don't know.
So at the bare minimum, we know that we can delegate a person to come up with the CE. It's just a question of whether or not authorization falls under public meetings law.
Whether the board needs to approve it, yes.
So we can do that. So let's delegate. We can at least do that. And then I can find out if authorization falls under public meeting law. And if it does, then we'll figure out a way to do that.
Do you have capacity for that, Amy?
To develop a.
Well, to be the official kind of point person, right? I don't know, is it, are you solely responsible for developing the content? I would
Well,
hope
we can
not.
provide support, but I don't know that we can do content. So, but we can obviously provide support. We can help with slides and that kind of thing. So,
I'm super confused, I guess, about how to make this happen then without a board meeting. This and this,
so the easiest way to do it, now that I'm thinking about it, would be if authorization falls under public meetings law, then what we would do is we would come together with a curriculum, and on the morning of the meeting, we would say, here's a curriculum, do you all approve it? There you go, done.
but I guess I want to make sure then, Kyle, are we dumping the entire curriculum developed on one person? Are they allowed to collaborate with other people or get input about it?
If it involves a board decision or board business, and you have communications with quorum, either that's together or serially, then
And a quorum is 4.
correct. Quorum's for the board.
Adore you, but you're not going to be here anyway. Right? So
There you
no
go.
disrespect,
Done.
but 1, 2,
Then
3, you don't count anyway as a
Not
board
count.
member. So we're actually okay then.
You would be good with less than a quorum as long as there wasn't any
Mhm.
communications with Stephanie or another board member. I guess
Okay.
Stephanie's the only.
Stephanie's out too, right?
I'll be talking to you.
Right, but we're talking about social workers developing an ethics training for social workers. So
Yeah.
again, with all due respect, I think it makes sense to
Yes, collaborate.
the 3, okay,
So the three of us.
are allowed to
Right.
talk about it and help develop.
Okay, sweet.
And I can provide whatever administrators. Absolutely.
That makes it,
Together.
that way makes it way more doable.
Okay.
Just Amy.
Okay, thank you. Sorry for my frustration. I just so like, listen,
Amy.
how my head spins on some of this.
Oh, she's got one.
I was like, I did,
Okay.
I did ethics training, like several
Yeah,
different
I've got-
conferences.
I
for-
did. Yeah,
Nice.
I got a bunch of content too. So we can decide what we want to do later.
Yeah. How many times?
You can contact me if you have any questions either. If there's anything I can do to help you.
Yeah,
Cool.
Ruby is very helpful.
Yep.
If there's going to be the 3 of you, maybe you guys could share the presentation. Everybody give a part of it.
We'll
Not
figure
one
it out.
person doing it.
We're not talking to you
won't
about.
figure
We're
it
just
out.
Yeah, we can't
We'll
talk
just
about
have
it.
one huge discussion.
You're a 4th.
I hate to put a wrinkle into this, but I'm looking at
I
the
teach
rule.
online ethics for
And it
massage
refers
therapists.
to, one of the criteria is provided or approved by a credentialing body recognized and approved by the board.
But is the board not?
I don't see that the board,
That's to approve.
unless you're gonna look.
We're not already pre-approved as a body is what you're saying.
Well, what you're talking about is a course that you're gonna be putting on, right?
Right.
I mean, it's not a study group.
Then how'd they do it last time?
I don't know. I wasn't
That's
here
how I
for
was
that part of the
gonna
meeting. And I wasn't consulted about it.
I think Randy's thinking was like, if a social worker submits a course for approval, then the accrediting body they put
Right.
in the CE portal is pre-approved by the Oregon BLSW.
But the Oregon BLSW is not a pre-approved, is what Kyle's saying.
The course would have to go to the committee to be
It is.
approved.
Uh-huh.
Yeah.
Oh.
But can we do it
We
the
could-
morning of the training?
Yeah, the morning of the training, we could approve it.
I don't know why you couldn't.
Okay, so then the training has to happen after the board meeting in order for us not to create a hoop for all of the members that then have to
Perfect.
separately ask
That
for.
would be the easiest way,
Okay,
simply to
so-
approve it that morning.
Why is the BLSW not on the board's list of accepted CE bodies?
Let's get that.
I don't, that's a
It's
separate way.
on the list of accepted, like, if you go in to do your CE, it's one of the options for
It
CE
is?
bodies.
It's
Yes.
if it's
Oh.
pre-approved by us, yeah, so that means if it went through our committee.
Okay, I get what you're saying.
Just make sure. Okay, so we fixed that.
That would be the easiest.
So you write that down. The board needs to be a credentialing body of the boards.
You got it.
And then the three of you could work together.
Whose idea?
to
Whose
develop
idea?
a Presentation
Who was
Okay,
this?
so
with the understanding that you are not acting as a committee or in any way. for the-
Right,
got it.
right.
Okay, board meeting first, then the training. We will approve ourselves. We got 3 people working on it. Wow,
Cool.
bureaucracy.
Good job, Mom.
Not me. I did nothing there.
Does everybody need a break? Or are we okay to finish up here?
I don't know how much we got left.
We're almost done.
Okay,
Almost.
I can power through.
Yeah.
Consent agenda's inbox.
So, proposed statement.
So.
Oh, there's a new,
Oh, that's right.
there's a new agenda
Yeah.
item.
Yes.
Yes.
It's the new agenda that Patty put in box for us to consider.
Oh,
Yeah, under new business.
Everybody has a chance to.
Proposed board statement.
Mhm.
I'm not an attorney, so I don't know if I got it all right. But on the
This-
proposed statement.
I didn't look at that, actually.
Okay.
And we have an internal process that I
Uh-huh.
couldn't really provide advice on this without going through our internal process.
Okay.
Anything that's related to immigration or gender conversion identity.
Excuse me.
So I actually didn't look at this.
Mhm.
I wasn't asked to, and I typically don't look at these types of
Okay.
things. So, I mean, if you want me to, I certainly could, but I couldn't do it today. And
Yeah.
I'd have to go through our internal process. So, and you're just making, you're making
That
it.
sounds like something we could.
So have other people looked at it?
I had a
Yeah.
question about paragraph 3 when it talks about the, what's prohibited under ORS 18805. And it references, the definition of public body. And my understanding is, because I had this question from a licensee, we're getting some of these questions.
Mhm.
A public body is a like state government, law enforcement, that sort of thing. So am interested in what, I'm pretty sure a social worker, individual social worker doesn't fall under that public body definition.
Yeah, hang on, I gotta read what you're talking about.
Has somebody tried to report somebody for this before?
No, they were asking about, just in general, and also what their consequence would be if they got arrested for going to a protest or whatever, and.
Yeah, we've had that
So-
question.
Yeah, and so because that's how I responded to them, is that a licensee in general is not considered a public body. Per the definition of OAR or ORS 174109.
So where are you in the third paragraph? Is that what you said?
Third paragraph.
Second,
Second.
that starts second since 1987. Is that where we are? Okay.
Yeah, but it's a second.
State. It is prohibited under. Immigration laws. Any social. So where's the reference to public body in that?
Public body, when you look up the actual OAR.
Oh, I see. Okay, I'm sorry.
Life references the definition of public body, which is 174109.
So you're questioning whether it actually,
So, so what follows that is the board will investigate any social worker who is accused of this practice. Well, if,
and you're not sure it actually says that they, okay. I guess I need to, yeah. Does anyone have the actual ORS pulled up?
you can,
I'm pulling up.
Or is it, okay, which one is, it's the first, second, or third one that references it?
first one, 180-805.
Thank you.
Oh, 805? Yeah, 805, yeah. So, oh, why did you give me that? Oh, that's why. That's all. All right, yeah, 805.
do we want to table this to the next meeting, have Kyle review it and give
He
his
can't.
input?
No, he can't.
Before we
There's a,
try to-
I can review it. I just can't do it today and I have to do it through an internal process through our office
okay.
because we don't.
That's a meeting you want that term. Okay.
All advice on this area is consistent and coordinated.
And what part of that in the OER are you talking about?
So, ORS 174-109 is the definition of a public
Right.
body in reference to immigration
Yep.
Yeah.
and a sanctuary.
Okay.
Okay.
So
Yeah.
like the question I've had from another social worker, my response is basically the board cannot provide legal interpretation or guidance because they were asking about
Mhm.
offering guidance around interaction with ICE officials and if there's specific resources. So I suggested that if they're a member of NASW, then their membership includes free legal and ethical consults pertaining to the practice of social work. And then also I guided them for definition for Oregon being a sanctuary state with regard to ICE and if, how they were approached. And that the definition, and then I guided them to the sanctuary promise at Oregon Department of Justice website. And by definition, state, local law enforcement and public agencies are referencing the public bodies.
Okay, so it says public body as used in the statute to this state. Public body means state government bodies, local government bodies, and special government bodies.
But it doesn't reference a
Reference an
licensee.
individual. No.
So I guess my question, Pat, because you're the one who kind of, drafted this up, considering that and wanting, I know the intention is to be very accurate in the information as well. Is this something you want to go back and?
Well, I think if we could get
Okay.
Kyle's review of this, I think that.
How hard is that gonna be?
Yeah, that.
Yeah.
Yeah. Gotta take out the
Go on
email.
vacation and.
That's
and
gonna
have
be a
a
good
board
chunk
meeting
of
with us.
change.
There is some guidance, like she said, on our website.
Yeah.
DOJ website.
Yeah.
And
I'll email that to you if you want, Patty.
And-
So
and we
maybe,
did come out with some model policies for agencies.
Yeah.
So
Okay.
that actually might be helpful to
Yeah,
answer your
yeah.
question. I'm happy to do it. It's
Oh,
just,
yeah.
I mean, one, I can't do it all.
don't forget that we pay him.
Well,
Yeah.
right. Yeah, I would, I'm gonna recommend to rethink that one.
Ray's direction to me has been not to review this stuff unless he asks me to.
Okay.
Because he doesn't want me
The
to.
DOJ is not cheap, and with the compact coming up, we might need that bandwidth to work on the compact.
Yeah.
So then it sounds like the request,
Okay.
maybe go back and look at those pieces and bring it to the next meeting.
Mhm.
Okay.
Well, is there any like immediate opposition from people about making a statement like this?
I guess my question, just as a staff would be, what's really the purpose? Why does the board need to take a stand on that issue?
Well, one, because there are executive actions that are going to affect social workers in our state that they're going to be they're going to start feeling torn in two different directions. And so if our board makes a stance on it and makes a statement about it, then we make clear guidelines for social workers under us.
Kyle, you had your hand
Has anybody confirmed with the governor's office about that?
Right, and so that's right, I have.
Yeah,
And so the governor's office prefers that before the board releases any type of a written statement, that the governor's office has a chance to edit it.
So-
It's even a consideration to release it.
So maybe even before it comes back here it goes to you and then goes to the governor's office, so that if we're gonna see it, we know governor's office has already seen it.
I think that'd be wise.
It's 2 months. Be plenty of time to jump through those hoops, I would think.
Oh, yeah.
and if you
6
have
weeks.
legal questions, I mean, Ray can reach out to me. with those.
Absolutely.
So, but yes, we have an internal process in DOJ. No advice in these areas goes out without being internally reviewed and coordinated. And I'm sure you can understand why,
Yeah.
given all the activity in this area.
And there's going to be a number of social workers in schools and different kinds of clinics who are already starting to feel the pressure around gender affirming care and also migration. That if
You might also want to check with like LPCT and Psych Board to see if
Yeah.
they're doing anything.
Mhm.
You know, because they're also sister or companion agencies that are mental
Yeah,
health.
yeah.
So,
Or MACBO.
Less regulation.
The
The state board.
yeah,
They are not a state body. No,
I wouldn't
they're
recommend
not.
you do that. So,
Okay,
Yeah.
okay.
other state boards, especially the.
Yeah,
I
they can go out
didn't
there.
realize that MACBO wasn't a state board, actually.
Yeah, no,
Hmm.
A lot more freedom.
So we got
When
a
I can
plan?
get those QMH please way fast.
I know,
Yeah.
that's,
Day of.
I love their website though. That's a model.
We good on that then?
We have a plan, it sounds like.
I
Yeah,
just
I will-
emailed you the link, Patty, to the DOJ website for.
awesome.
Right. Yeah, they got.
Thank you very much.
Yeah, and if anybody else wants it, I can forward them as well.
that's pretty good. That's only made like about a week ago.
I know, well, I don't remember how I came across it, but I did some research and probably
Yeah,
Google.
we came out.
I just think like, even if the governor made a statement, right? Like, if the governor is making a statement, then the board can always just repeat.
Oh, of course.
That statement,
Yes,
right?
absolutely.
Maybe like,
Right.
Plus, isn't there some protection for medical related?
Yeah.
I thought I read something about there's like medical related protection, but I could be wrong.
I'm not sure what you're referring to.
All right.
Or from like, I mean, there's like HIPAA protects
No,
people.
yeah, but
there-
I thought
there's
this was specific
second-
to immigration.
Second level, yeah.
I'll have to review it.
Because there has been like cases where ICE has requested people's medical records or requested access to records in different states.
Well, the sanctuary law prohibits providing if it's in certain, for certain types of things. So,
Right.
Yeah, and on that website, there is a section for hospitals and healthcare settings.
Mhm. Okay.
So it's a really good and informative website.
and that's on the DOJ's website.
I can send you the link. It's called Oregon Department of Justice Sanctuary Promise Guidance.
Oh yeah, that was in the training that we had to do. There's a link to it, I
Yeah.
think. Yeah. All state workers had to recently do a training on immigration laws.
Some states also have been releasing records, like medical records on like trans youth, like their transitions.
Without a court order, because that's the only,
Well, because they've made like different laws in different
Oh,
states
yeah.
against it that like will consider, I mean, like Florida, for instance, has it's considered child abuse to like help a kid
Hmm.
transition.
But that's not Oregon, so
No, this is one of the problems with one of the big problems with the compact is that Florida is in the compact, right? And we would have to abide by Florida
I don't know.
laws.
Yeah, I think that's just, I mean, I think
Yeah.
that is, as a social worker, right? Like, then they're very the social worker becomes very vulnerable. So that's disruption. There's a bonus.
well, there's still be a quorum,
Okay, good.
so the meeting can keep going. As long as nobody else leaves.
Okay.
can we move on to the consent agenda then?
Sure.
It's in box.
Uh-huh.
And when everyone's ready, we'll take a motion to approve the agenda, consent agenda.
This is John. I make a motion to approve the consent agenda as presented.
Small,
You're on.
Smalley, a second.
Thank you, Molly. All in favor? Opposed? Any abstentions? Motion carries. Correspondence. Do we have any correspondence this month? Nothing? announcements. NSWA gave his announcement. I wanted to just give an announcement for ASWB. In May, the Education Committee is going to be meeting in Portland. They'll have some CEs there and they'll have information. And I encourage anybody that can or wants to attend, go. I don't think you're going, are you, Amy? You weren't going to go?
I am not. I'm going to go to two other, I got named the chair for the research committee. And so I'll go to the two other sessions that I have to go to.
Fancy.
Yeah, fancy.
Congratulations on
Really,
your
that just means I
leadership.
wrangle folks.
So the chair is a recent thing. I know you're part of the committee before.
Yeah.
So,
Yep,
cool.
last week.
Congratulations.
And
And
then
you have a new
on-
member who's an ex-board member also, Amy. Kathy Outland's going to be on your committee.
Lovely.
Know that?
hold on.
Wendy's going to go to,
Yes, go ahead.
were you going to say that, Ray?
I was gonna say that, but you said it.
No, you
You said.
you know more of the details. I was just going to mention. Go ahead. Wendy can tell us. There's Wendy. Tell us, Wendy. You're going to Savannah, Georgia? Is that where you're going?
I am next month. I'll go to the new board member meeting.
New board member training.
Training.
Yeah, that one.
That's
I noticed the
ASWB,
topics.
right?
Yes, it's the ASWB new board member training, which I've never been to one. None of the new member trainings, even though I've been here for 13 years. I've never been to one. But I did notice that some of the topics were pretty relevant to the licensing compliance that I'm doing. So I really wanted to reach out and see what more I can learn.
Where's it at? Georgia?
It's
Yeah.
Savannah, Georgia.
Yeah,
Savannah.
that should be nice.
Yeah,
Did
Savannah.
you want to re-up again now, John?
Wait, say it again.
He's asking John
I said, John,
if
did
he
you wanna
wants to
re-up
re-up.
again so you can get to a
No.
training?
No.
It's gonna be a new one again?
There was no hesitation there. He's got his plaque. He's good to go. Yeah, we can't modify his.
Look at my name tag.
That's one foot out the door.
I got a question about that. So, I wonder, so when ASWB like flies people, because they'll fly people out and like they'll get them hotel rooms, like
They
feed
pay
them
for
and stuff,
everything.
right? Pay for everything. Does that become a conflict of interest when we're talking about about eliminating the ASWB exam? So like, I mean, that person, like, then it seems like because they're getting gifts from the ASWB that, if like, for instance, Amy, like if you're a part of the ASWB, like, does that then become a conflict of interest when we're talking about eliminating the ASWB exam? And I kind of think that it does. So,
We're a member of the ASWB.
Yeah, the board is a member of the ASWB.
That's just one component.
And there's
We
no
belong to it.
gifts. They're not
And they
gonna give
have-
me
Yeah,
gifts.
there's no
An
gifts. It's-
exam committee too.
it's hard to say. I mean, like if they're flying people out and paying for everything,
That's their attendance.
I know, but
So we're going to move forward now to number 7, executive director reports. Ray, it's all yours.
All right. Starting out with the legislative update. Let's see. So, this past, was it Thursday, Friday, last Thursday, Friday? We had the subcommittee, I guess the House subcommittee asked for a bunch of other boards to come in and speak on different compacts. So there were like 6 or 8 compacts. The Board of Licensed Social Workers did a presentation and what do you call it? Testimony. Thank you. Testimony on SB 2554, which is the current version of the social work compact. It's no different from the opinion that I gave last, or from the testimony that I gave last time, because the bill hasn't changed at all from the last time they introduced it. Mostly there were some constitutional conflicts and some funding conflicts, and we talked about all of those before. it's hard to tell if the bill's gonna go to the next step or not, but if it does, I'll inform the board and we'll move forward from there. And thank those who were willing to testify. And as I know more, I will probably be asking again for if you all will be willing to testify again. So any questions on that? Okay. The next one is psilocybin. That one's going to be going before the legislature soon. I don't have anything for that now. He's supposed to come here. I was trying to get him to come in this week, but he couldn't. And he's going to come and talk to me and the executive director for the mental health regulatory agency downstairs sometime next week. And so we'll have a discussion on where we left off with that was the specific language that was going to be in the bill and whether or not that specific language limited that the dual licensure to one step in the process, because I think that's what makes the difference. Is it all over or is it just that one step? If it's just that one step, then it's much easier I guess if we have a complaint to come in, it's much easier to deal with that complaint if it's down to one step. So that's what he's going to talk about when he comes in. I'll figure out a way to get that information and to get some feedback from board members as to what you all want to do once I understand what that language looks like. Any questions on that? Yeah. The next one is this coming Monday. The Board of Licensed Social Workers has been called to do a presentation at the Ways and Means Committee, and it's basically a budget presentation. I thought I had it ready, a document ready to drop into the box this time so that you all can see what our budget looks like. But I'll make sure that at the end of this meeting, either today or Monday, I'll make sure that something's in box so you all a concise version, because what we have now is this multi-page document with like 37 things in there. And so what I'll do is I'll concise that thing down so you all can look at what our budget looks like. And then I'll also send that presentation out so that you all can see what I'll be presenting, the Ways and Means. I don't expect anything unusual to come out of it. I talked to the Chief Financial Office and also the Legislative Fiscal Office, and they don't seem to think there's anything that that we as a board really need to be concerned about. The only, I think, subject of discussion that would warrant any kind of concern at all would be we have requested 625, or we requested, well, I think we requested 750. And then and what they came back from the budget was they're going to give us $625,000 towards a new licensing system as a one-time general fund allocation. And that's gone through the Chief Fiscal Office. It's going through a Legislative Fiscal Office. They all seem to be fine with it. And so I don't anticipate that that's going to be an issue when I have that do the presentation. So anyway, so that's going to be, I'm really excited about that. So getting that money so we can get a new licensing system.
So is that on the agenda? Is that 7C, the Thentia update?
No, that one we're still at 7A.
Okay. Oh, still 7A.
I'm going to talk about Thentia.
Sorry.
Yeah, still at 7A. And then the last thing is, I guess the best place for this one is the legislative update. You all probably know more about this than I do. There's Oregon Health Authority is going to do a rule change that has to do with those, in our case, CSWAs, but it's basically anyone that doesn't have a professional license. They are changing their Medicaid funding structure so that only if like CSWAs and those that don't have a professional license, and Kyle actually would probably know more about this than me, have to work under an organization that has a COA. I'm guessing you guys know more about that than me, a COA, in order to get funded by Medicaid. So they can't work in any organization that doesn't have a COA to get funded by Medicaid, which is going to change the way CSWAs function. So, and there's really not much we can do about. I mean, that's no HA thing. Mm-hmm. So the board doesn't really have a whole lot to do with that. Although you're more than welcome to contact them and questions. So.
Does that limit as far as employment for them?
Yeah.
Right, in terms
would-
of probably, it will
in that-
probably impact certain places where people are trying to get their clinical hours.
Especially like in rural areas, maybe?
Maybe, yeah, I don't know. I think it, maybe these places that are kind of outpatient, and they almost run like a private practice, but they also are, like, I don't know, they pay you like a percentage of your hours kind of thing. A little bit, yeah, so it's not, yeah, I don't know how to describe it. Sorry, I'm having trouble. I can think of examples, but kind of like Better Health, but not that. I mean, like even a brick and mortar version of that, I think it might impact some of those, which makes me wonder, what we should be trying to message out from the board, because what I wouldn't want to happen is CSWAs who are currently in a place like that, getting their hours and then getting news all of a sudden, like, nope, you're done. And I would hope that the organizations that this are going to be impacted are aware of it, but we also can't count on that, So I just would like the board to be thinking about that.
Yeah, so we'll, Kim, let's get together and figure out some kind of messaging to send out to CSWAs, so that they know how to get information on this new OHA rule.
Okay, it does look like we just had a comment that says, that will slow down the license process by limiting where they can get their hours.
Yeah, we're aware, which is why we want people to know ahead so they can make plans to shift and make informed decisions about where they're going to maybe work and get some extra hours, because it's not a board issue. It's an OHA decision.
And it's just for Medicaid too, right?
Yeah,
It's
right.
It won't come for other insurance.
Yes, yeah. So for some places that are only doing private insurance. Yeah. So it will still have an impact, but hopefully people can make the pivot.
Some agencies not have a certificate of approval and they just have an agreement, like say with their CCOs to provide mental health services. So here I am, I'm agency X. I don't have a certificate of approval from OHA, but I have a contract, say with All Care or whatever, like Yamhill CCO, to provide that. What that will do for that agency is, and then other CSWAs will
be
CCO
it's just
won't
payment.
pay that.
It's payment.
Oh, wow.
And so then those agencies then, if they're relying on Medicaid funding, will then not hire CSWAs. And then CSWAs almost get strong armed, if you will, like you're going to have to go work for an agency with a COA. And I just see like this domino effect of like, then here's an agency, I don't have a COA, but if I want to keep my CSWA, then I got to go get a certificate of approval. Well, that all goes through OHA, and then OHA is just going to like have this backup of people trying to
And
COA.
the benefit of that, as far as HOA is concerned, is what?
I don't know.
Okay.
None of us were in the room for that. Did you know, Ray, for programs or agencies that don't have a COA, is OHA going to not just message to them, hey, you don't have it, but be clear about a pathway to get one, so that maybe some of them could be working towards that before this actually comes into play? Did they talk about that at all?
So I've reached out to OHA to try to get more information and to be able to send some messaging to the CSWAs that are part of the Board of Licensed Social Workers without much success.
Okay.
So I have some information, and all I can do is send it out to the to the CSWAs that we have. I wish I had some direct information from OHA that was more helpful.
Hasn't
but
even been opened up yet.
No, that's what I was curious.
No.
If OHA was proactively creating like some messaging around it before it does, or like, hey, if you still have time to get your COA before this comes into effect, or to start working on it.
Yeah, there's public information floating around about it. What I can do as part of sending out communication to the CSWAs is send out information so that they can align themselves with organizations that get more information than I'm getting, that I can't do.